Hello my dear colleagues, today I have brought to you all a video on corneal tattooing. Keratopigmentation, better known as corneal tattooing, has been used for cosmetic management of corneal opacities over more than 2000 years. Galen was the person who first introduced this procedure to cosmetically manage patients with corneal opacities. Different chemical inks have been used for this purpose, which could be Indian ink, organic colors, Chinese ink, animal uveal pigment, platinum chloride, or even a simple candle soot. Here I have a young 58-year-old female who came to me stating that she had lost her vision in the right eye, which could not be operated, which could not be corrected. Thus, I suggested her options for corneal tattooing or corneal contact lenses. So as the patient opted for a corneal tattooing, here I shall show the process. Prior to surgery, vision was confirmed to be PL negative in the eye, as well as an anterior segment OCT was taken to know the corneal thickness. So the first step in this is to use a 350 micron blade to create an incision that is almost 30 to 40% depth of the corneal thickness. The lamellar tattooing is similar to the process of dissecting for a Descemet stripping endothelial keratopathy. So once the incision is done, a crescent is used to create a plane. So once the crescent is used for the initial smooth dissection, we use a straight lamellar blade which dissects the anterior half of the cornea . Once the initial half of the cornea is dissected with the help of a straight lamellar dissector, we use a curved lamellar dissector to go along the curvature of cornea and complete the dissection. Care should be taken that it is not very deep that we create a perforation, nor it is very superficial. Now it is very important to make sure that all the adhesions in the cornea are broken. Following this, the India ink is taken in a 1 cc syringe and with the help of cannula, it is injected into the plane. So following the injection, it is made sure that it is evenly spread all along the layer of the cornea. Now as we can see, in this case, the opacity or the haze is slightly more anterior. Hence, it is only an intralamellar tattooing may not suffice for this patient. In this case, it is superadded with a superficial lamellar tattooing. Once the epithelium is completely debrided and the entry of the intralamellar pocket is sutured, superficial tattooing done with the help of a 30 gauge needle or a 26 gauge needle. So this is basically creating an anterior stromal puncture with which we are inserting the ink beyond the Bowman's layer into the anterior stroma so that the ink is retained for at least a period of 3 to 6 months and thus providing cosmetic benefit to the patient. And finally, after removing all the additional tattoos that are spread all over the conjunctiva, a contact lens is placed to the patient. So here we have the pre-op photo as well as the post-op, where the patient is very happy. She feels that her confidence is boosted because of her change in her appearance. Thank you, my dear friends.